Thank you. The final item of business is a members' business debate on motion 22992 in the name of Alexander Stewart on World Stroke Day and Stroke Care in Scotland during the COVID-19 pandemic. This debate will be concluded without any questions being put. Can I ask those members who wish to speak in the debate to press the request to speak buttons now? And I call on Alexander Stewart to open the debate. Mr Stewart, please.
Thank you, Deputy Presiding Officer. I'm delighted to be able to take part tonight in this members' debate, and I thank members who signed and supported this motion. Firstly, I would like to pay tribute and acknowledge World Stroke Day itself. Observed on the 29th of October each year, World Stroke Day raises awareness of stroke and the contribution that individuals have suffered. And it's in that spirit that the very simple message that I once again will bring to this Parliament. Because back in June 2017, I brought a members' business debate into the Chamber entitled Stroke Care in Scotland. My address at that time highlighted the sheer number of people in our country experiencing stroke on an annual basis, and for those who survived the efforts that were being looked after and supported. And I'd like to highlight the level of stroke care in Scotland, including the areas of thrombectomy and the need for that to improve. In my conclusions at that time, I welcomed and acknowledged the work that had taken place to ensure that we had facilities that were supporting victims and their families. The debate also recognised the general optimism that was taking place to ensure that we had high-quality support of stroke nurses, support systems and pathways in place to support individuals. And the pragmatic approach that survivors have about recovery, well-being and aid in secondary prevention. Deputy Presiding Officer, that was nearly 3.5 years ago, and since that time, despite all the good intentions echoed in the Chamber by the then Minister, we have not seen that much changed. And how is that? Well, the same loyal constituents are still in touch with me. The same highly dedicated healthcare professionals contact me on a regular basis, and I still work with these hard-working charities across Scotland. And as my participation in the cross-party group on health and heart disease and stroke, which I co-convene. And we have these regular meetings, and I would like to commend and congratulate the fantastic work of stroke charities across Scotland who contribute. These are the Stroke Association and Chest, Heart and Stroke, and I'd like to put on record my gratitude and commitment for them and the fantastic staff they have. And I'd like to include Colin Oliver of the Stroke Association and Catherine Byrne of Chest, Heart and Stroke Scotland, because they support the group and they support individuals right across the country. Both charities have identified that stroke care in Scotland has been failing in key areas for some years. This is despite the best efforts of truly extraordinary stroke specialists and staff across the country. In addition to this, we also know of the commitment to improve the key areas announced by the Scottish Government back in September 2019. And of course, the work has welcomed and we have seen across stroke that has massively been impacted by COVID-19. But we cannot blame COVID entirely, as many call for, because back in 2017 in this chamber there was promises made and commitments were asked for, and over the last 3 years we have not seen some of those commitments come to fruition. And I know that things like thrombectomy across Scotland has had major difficulties ensuring that that was transmitted and supported. And as we've heard, many people who have suffered, and there were 600 people who could have benefited from thrombectomy across the country. And the treatment is cost-effective. We know that many people know of the development of supporting, and I'm delighted to see that we have seen some reassurances recently in NHS Tayside, because that has definitely helped thrombectomy in that area. But there are also areas in Scotland that are now beginning to see and moving forward. But I welcome that, Deputy Presiding Officer, but it is sometimes too late for some people that that is the case. Thrombectomy is cost effective, and the quality of care stroke we've all seen, and that awareness, that understanding of what is happening. But it is a postcode lottery, and we have to recognise that. The simple action that's taking place that is not helping everybody, that is making sure that more people can be disabled because of a stroke. Every 10 minutes of delay in treatment between arriving at a hospital and receiving clot-busting drugs can have, and shown has, it has taken a month off a patient's life. This year's report on NHS Scotland's Stroke Improvement Programme showed that key targets for assessing vital stroke care was still being significantly missed in 2019, well before the pandemic started. The latest stroke care audit, published in September 2020, shows a third of stroke patients do not receive the most basic levels of care that is known as the stroke care bundle. Indeed, the stroke care bundle compliance is 64% across Scotland, admittedly a small improvement from 59% in 2018, but overall compliance still remains far below the 80% standard that has been set. And we have seen many health boards not managing to challenge and make sure that that becomes the case. Although there have been some improvements in NHS Dumfries and Galloway, NHS Tayside, NHS Ayrn Arden and NHS Highland. The rest, we have seen no statistically significant change or improvement, and that has to change. The compliance that has taken place to ensure that people have the opportunity to get the support they need. Now, we know, Deputy Presiding Officer, that if you're in Scotland, you are more likely to have a stroke earlier than other parts of the United Kingdom. And we know that people die in Scotland of strokes more than they do in other parts of the UK. And during the pandemic, access to rehabilitation has been limited or stopped altogether for so many individuals, and that they have felt they have gone backwards. All of this is an issue that we are well aware is devolved to the Scottish Government. So it's vitally important that we work together to ensure that we embrace and we change the quality of stroke support to ensure that individuals get that access and get that support mechanism that they rightfully require. So in conclusion, Deputy Presiding Officer, I support and echo the Stroke Association's principles to call for the Scottish Government continue to make urgent progress on the programme for government with stroke commitments, and that the Scottish Government establishes a regular reporting mechanism for all stroke conditions, and to ensure that this Parliament receives regular updates. Only regular progress updates will ensure that stroke and its care does not become lost in the midst of this current pandemic. Thank you, Deputy Presiding Officer.
Thank you very much, Mr Stewart. Open debate. I call James Dornan, to be followed by Brian Whittle. Mr Dornan, please.
Thank you, Presiding Officer, and I'd like to start by thanking my colleague Alexander Stewart for bringing this incredibly important issue to the Chamber, and Chest Heart Stroke Scotland for their very helpful brief and all the good work they do in keeping the dangers of stroke at the forefront of our thinking. Stroke is a many-headed monster. It attacks in so many different ways that it's almost impossible to prepare for. And then when it does hit, it affects everyone in different ways. Just 3 examples of how people are affected and their different roads to recovery. My partner Elaine had a stroke 5 years ago. You'd never know that to look at her, except for sometimes when she walks too long. However, she assures me that the long-term damage is still with her. She forgets things regularly, can be a bit unsteady at times, as to some other long-term issues which we're still dealing with. The good thing, if that's the case, is that she was young and fit enough to get to where she is today. Her mother had a stroke in February this year, and clearly she's older, so recovery can be much more difficult. We're also living through COVID-19, and despite the care and attention she lacks some of the ongoing physical and emotional support that may help her recover in a more speedy manner. The last example is a friend of mine, Paul. He had a stroke a month ago, had all the usual recognisable symptoms, paralysis down the left side and slurring. Paul is a writer and blogger. He's also left-handed. So within the first week of his hospitalisation, he started typing slowly with his right hand, did all the physio asked of him, and he just told me this afternoon he expects to get home on Friday. Good news, but for all 3 of them, the early impact was one of fear. Fear that they wouldn't walk again, talk properly again, and that life as they knew it was over. However, that's not always the case, as has been shown from these examples. All strokes, all different impacts and pace of improvements, but in that fear, they all have something in common. These experiences are sadly not unique, and countless families have had their worlds turned upside down, whether it's the person who experiences a stroke themselves or the family and friends who often undertake unpaid caring duties. The effect can be life-changing. Stroke remains a leading cause of disability in Scotland and the third biggest killer. Over 3,800 deaths in Scotland in 2018, with cerebral vascular disease, including stroke, was the underlying cause. However, there is some cause for tentative optimism. Over the past 10 years, the number of people dying from stroke in Scotland has decreased by more than 35%. According to the Stroke Association, there are almost 120,000 stroke survivors living in Scotland. Well, surviving stroke is one thing, being able to live with the resulting health implications is another, as I've already described. All survivors deserve the best possible chance of living without disability or dependence after a stroke. Presiding Officer, that is why I welcome the Scottish Government's commitment in the programme for government to introduce a high quality and clinically safe thrombectomy service in Scotland. Thrombectomy, as Alexander Stewart earlier said, does deliver a significant benefit for some patients who have sudden onset of stroke with significantly improved outcomes and a reduced level of disability. This new service, when established, will ensure that those who experience severe stroke receive the best possible care, reducing their risk of long-term disability. From figures cited by Chest Heart Stroke Scotland, at least 600 people per year in Scotland would benefit from a thrombectomy. I am delighted that Queen Elizabeth University Hospital campus in Glasgow will provide a hub service for the West of Scotland by 2023. Presiding Officer, someone has a stroke every 5 minutes in the UK, and it can happen to anyone of any age at any time. All members participating today will share a desire for further reducing the number of deaths from stroke and improving treatment and care. And at a time when COVID is understandably grabbing most of our attention, it's vital we keep stroke in the agenda. And that is why I again thank Alexander Stewart for affording us this opportunity this afternoon. Thank you.
Thank you very much, Mr Dornan. I call Brian Whittle, be followed by David Stewart. Mr Whittle, please.
Thank you, Deputy Presiding Officer. Can I also thank my colleague Alexander Stewart for bringing this important debate to the Chamber. I have spoken on this subject before, but this year, of course, it's even more important given the extraordinary situation in which we find ourselves. Prior to COVID pandemic, stroke care has been falling generally in Scotland, and there was a commitment by the Scottish Government in 2019 to address that trend. COVID, of course, has exacerbated the issue. And a recent Recovery at Risk report actually tells us about the impact of COVID-19 on stroke survivors and carers in Scotland. More than half say they've received less support from health and care services than usual. More than half of stroke survivors reported they'd had therapy cancelled or postponed, and 2/3 reporting feeling more anxious or depressed, which of course is a general theme throughout the country, exacerbated by a condition like stroke. Now, as everybody knows, I speak quite a lot in here around the preventable health agenda, and I think stroke fits very well into that agenda. Scotland does have a poor health report card, and I think COVID highlights that by the impact of COVID on ill health. We are more likely to have a very poor result from COVID if you have a condition like stroke. So it is incredibly important that we tackle this. I think I said before, Scotland, as Alexander Stewart said, you're more likely to have a stroke in Scotland than in any other parts of the UK. You're more likely to have a stroke in Scotland at a younger age. The average age is 4 years below the rest of the UK. You're more likely to die from a stroke in Scotland than any other part of the UK, and Scotland has the largest percentage of its population who are stroke survivors. So we know the scale of the situation that we find ourselves in. However, there are some really good practices out there that I would like to highlight, and one that I've spoken about before is the stroke physiotherapists in Kilmarnock, who have taken it upon themselves with a grant to look at extending the care for stroke survivors beyond the 6 weeks that they get within hospital. So they've taken into the community, they've taken that rehabilitation into the community, and not only do they look after stroke survivors, they look after quite a lot of other issues, sort of comorbidity issues as well. And what they've highlighted to me is the positive outcomes that can happen, because prior to them taking this into the community, they were telling me there's a lot of stroke victims basically sit at home scared, worried about their next stroke and frightened of having another stroke. But by taking this into the community, by the cunning use of a cup of tea and a biscuit, which they can get to if they undertake a little bit of physical exercise, that has actually helped them to get back into the community and back into mainstream, and some of them back into work. And that's exactly what we want to happen. But as I said before, COVID has highlighted a major issue here around the number of conditions that have been impacted by the COVID restrictions that have been put in place, which have been well rehearsed in this chamber. But I was contacted today by a constituent, and I'm going to quote this constituent, who said they feel let down by the system. There was no support at all for the stroke survivors in the area. Everyone's having a challenging time just now, but the lives and recoveries of stroke survivors across Scotland have been particularly badly affected, and we need you to stand up for us. Their call to the Scottish Government is to make urgent progress on the stroke commitments it made prior to the pandemic, and to make regular reports to the Parliament so we all know what's going on. It is vital that people affected by stroke are not forgotten due to the COVID-19 pandemic, which is once again why I thank Alexander Stewart for bringing this important debate to this chamber to allow us to highlight the issues that are currently standing in the country. Thank you, Deputy Presiding Officer.
Thank you very much, Mr Whittle. I call David Stewart to be followed by Beatrice Wishart. Mr Stewart, please.
Thank you, Presiding Officer, and could I also thank Alexander Stewart for securing this evening's important debate and also for the quality of his speech. I think it's crucial that we draw attention to the care of victims of strokes and be clear on the symptoms to hopefully prevent some of the life-changing ordeals that individuals endure. The excellent briefing provided by the Chest, Heart and Stroke Scotland raised the issue that improvements to stroke care have stalled since COVID-19 arrived in the country. And this will be a sad story across many areas of health, such as access to support and rehabilitation. Non-urgent and outpatient appointments being delayed have all led to stroke survivors reporting that the recovery has not only stalled but gone backwards. However, the strong campaign and alert messages of FAST, the Face, Arms, Speech and Time, has been a very positive way to make communities aware of the signs of a stroke, and hopefully meant that more victims were able to get help in time. It's now more critical than ever that we spread the message, as there's also evidence suggests that COVID-19 increases the risk of blood clots and strokes. Strokes, as we've heard from previous speakers, are the third most common cause of death in Scotland and the most common cause of disability. So that's why it's so important we help make more people aware of how to help, but also call for increased support, both through the NHS and through the important work that's been done by the third sector. As again we've heard from previous speakers, sadly chances of having a stroke are higher in Scotland than other parts of the UK. It's more likely to be had by younger people, as the average age in Scotland is 4 years below that of the rest of the UK, and are more likely to die from a stroke in Scotland than the rest of the UK. And Scotland has the largest percentage of its population who are stroke survivors. Some pretty sobering facts. It's estimated that the number of stroke survivors in Scotland will increase by a whopping 50% over the next 20 years. It is vital then that we put in resources now to ensure that the NHS is able to support victims and families in the years to come. We've also heard about the importance of thrombectomies, which are innovative surgery which removes blood clots from arteries and veins, and some pioneering work has been done within NHS Tayside. It's currently not a national service, but again, as we heard from previous speakers, there's some suggestion this will be rolled out in other parts of Scotland, which is crucially important. Alexander Stewart made a very important point about the stroke care bundle, which includes aims to reduce the risk of death and increase the likelihood of people returning home to recover from their stroke, quick admission to a stroke unit, as well as fast access to vital interventions like a brain scan, swallow screen and administration of aspirin, was set a target of 80% across NHS health boards. The compliance went from 59% in 2018 to 64% in 2019. But still, significantly fell short. However, it should be noted that 4 health boards did improve, including my own of NHS Highland. So what is needed is a joined-up approach between the NHS, social care services and charities to ease pressures on stroke services and staff so that the quality of stroke care can improve and provide community-based holistic support. And I want to thank the dedicated NHS staff for working flat out in these trying and complicated times. I want to thank the charities and sector organisations who dedicate their time to supporting this work, and to thank social care providers and community pharmacists and physiotherapists who are all part of this work. And I want to thank the families and thousands of unpaid carers who have given their time, energy and love to those who need it through the trauma and often lasting effects of strokes. And finally, thanks again to Alexander Stewart for having the initiative in securing tonight's debate.
Thank you very much. Mr Stewart, I call Beatrice Wishart to be followed by Kenneth Gibson. Mr Gibson is the last speaker in the open debate. Ms Wishart, please.
Thank you, Deputy Presiding Officer. I too would like to thank Alexander Stewart for securing this important debate and for raising the importance of strokes and World Stroke Day, and I'm pleased to support the motion. Strokes haven't stopped because of COVID, and we must ensure survivors have equity of stroke care during and after the pandemic. 10,000 people have strokes each year in Scotland, and for survivors the impact can include speech and communication problems and physical disability. It can be devastating, and the impact isn't just on survivors, but as others have said, on their carers, families and friends. In Shetland, there are around 40 people a year who have strokes, a figure that's come down from 55 a year in the last 15 years, with 2/3 of patients surviving the stroke. Lifestyle changes, along with improved treatments, have impacted on that figure, but so too has the work of dedicated healthcare professionals across the country. Professionals like Dorothy Story. I'd like to take this opportunity to pay tribute to Dorothy, a recently retired specialist stroke nurse. Her dedication to the care of stroke survivors is well known in Shetland. She's also played an active part in the local stroke support group, and I wish Dorothy well in her retirement. I recently met with members of the Shetland Stroke Support Group, a virtual meeting, of course. They're a fantastic group of people who, under normal circumstances, have a busy schedule of get-togethers and outings to various parts of Shetland. They've missed those visits this year, and like everyone else, they're having to adapt to the new normal. They have a strong networking bond, providing each other with much-needed support. And this is especially needed in island and rural areas, where accessing treatment and support services isn't always easy. With services centralised in Lerwick, it can be a tiring journey to hospital before the start of, say, a physiotherapy session for a stroke survivor from the North Isles. I also know personally the impact of a stroke on a family. My mother was living in Aberdeen at the time of her stroke in 2004. I rushed to Aberdeen on the first flight I could get from Shetland, but by the time I saw her in A&E, she had lost the power down one side of her body and her speech was obviously affected. I'm firmly of the belief that when the consultant eventually came to discuss her prognosis, she had been dismissed in terms of receiving any treatment simply because of her age, 81 at that time. Even if she could have benefited from a thrombectomy, she wouldn't have received it. She's had a long life, he said. That was true, she had, but he didn't know her spirit, simply her date of birth. She returned to Shetland to live in a care home, but the effects of the stroke caught up with her, and she spent a very prolonged period in hospital until her death, aged 87, cared for by a wonderful dedicated team in Ronas Ward. I use this as an illustration of how far stroke treatment and care has come in the last 15 years. But as the Stroke Association highlights in their briefing to MSPs, there's a wide variation of performance between NHS boards, and a patient's outcome is dependent on where and when you have a stroke. I share their call for a national thrombectomy service that fully works and an improvement to the door-to-needle times. Please let's end the postcode lottery of stroke care across Scotland.
Thank you, Ms Wishart, and I call Kenneth Gibson.
Thank you, Presiding Officer, and I congratulate Alexander Stewart for securing valuable debating time on a matter which affects so many of us. Indeed, a stroke can happen to anyone, anywhere and any time. They're the most common cause of disability and the second most common cause of death worldwide.
According to the World Stroke Organisation, 14.5 million people have a stroke each year, and sadly 5.5 million die as a result globally, although research shows that almost all strokes can be prevented. Here in Scotland, about 15,000 people have a stroke each year, and hospital care for stroke patients accounts for 7% of all NHS beds and 5% of our NHS budget. Yet, despite the frequent occurrence of strokes, many people are unaware of the numerous, often life-changing challenges faced by patients who survive a stroke. These include communication difficulties, physical disability, change in how they think and feel, loss of employment, income and social contact. Fortunately, research has proven the effectiveness of organised specialist stroke care in improving outcomes. The Stroke Association report, Stroke Recoveries at Risk, has found that, unfortunately, almost all aspects of stroke treatment and care have been impacted by the ongoing COVID-19 pandemic, which is affecting the lives of stroke survivors and their families across all stages of the recovery and in all countries of the United Kingdom. Because of the COVID-19-induced severe pressure on the National Health Service, over half of all stroke survivors in Scotland had their therapy cancelled or postponed during lockdown. Other survivors' stroke-related appointments were conducted over the phone or online in order to protect them from contracting COVID-19. Encouragingly, satisfaction of these virtual or phone appointments was reasonable, although with room for improvement. 58% of stroke survivors in Scotland felt satisfied with virtual methods of rehab and health care, compared to the UK average of 52%, which underlines the innovation and dedication of our fantastic NHS workers, even in the most challenging of times. I also welcome the report's findings that, compared to the UK average, a high percentage of stroke survivors in Scotland felt they had been given enough information about how lockdown guidance applied to them. Yet, unfortunately, stroke survivors' mental health has significantly worsened in Scotland and across the UK. Many survivors reported feeling more stressed and depressed during lockdown, while carers are also feeling additional pressures. I therefore agree with the report's conclusion that now is the time to deliver stroke improvements from prevention through to long-term support. It's encouraging that the Scottish Government continues to implement the Stroke Improvement Plan, which reaffirmed stroke as a clinical priority for NHS Scotland. In the past decade, the number of people in Scotland who died from stroke has decreased by a heartening 42%. Although this progress makes me optimistic, we must continue to improve care and outcomes. I therefore welcome that after a coronavirus pandemic-induced delay, a pilot thrombectomy service is due to launch at Nine Wells Hospital, Dundee, and the Health Secretary has already announced the availability of similar services in Edinburgh and Glasgow for 2021 and 2022 respectively. It must be our goal to have thrombectomy available for everyone who needs it by 2023. For this to be workable, a strong support and framework also needs to be in place for all stroke patients before and after their stroke. It's promising that the latest stroke care audit report showed a 5% increase in stroke care bundle compliance. This means a growing number of hospitals and units now meet the standards of basic care which every stroke patient should receive when they arrive in hospital, such as access to swallow testing, aspirin or brain scan. Yet remaining variations in the proportion of stroke units and health boards meeting these standards must now be addressed as the Scottish Government continues to progress its ambitious 2019-2020 programme for government commitments. Presiding Officer, I am confident we will not only carry on reducing the number of deaths from stroke, we will also make a positive difference to the lives of survivors and their carers, while easing the growing burden of stroke on our health and care system in the years ahead. And it remains just for me to once again thank Alexander Stewart for bringing this debate to the Chamber.
Thank you very much, Mr Gibson. I call on Joe Fitzpatrick to close for the Scottish Government. Minister, please.
Thank you, Presiding Officer. And I'm delighted to respond on behalf of the Government to this debate. And I wish to thank Alexander Stewart for lodging the motion, securing the debate, and for members across the Chamber for their contributions. Mr Stewart is absolutely right about the importance of raising awareness of stroke, and I'd like to join him in his acknowledgement of World Stroke Day. I also want to acknowledge the important findings of the Recoveries at Risk report published by the Stroke Association and mentioned by a number of members. I fully agree that stroke has a significant impact on people across Scotland and that the COVID-19 pandemic has exacerbated that impact. Stroke is the third commonest cause of death in Scotland and the most common cause of severe physical disability amongst adults. This condition has a significant impact on NHS resources, accounting for approximately 5% of total NHS costs, and it has an even higher societal cost. The personal impact on people who experience a stroke and on their family members, friends and carers is massive, as James Dornan and Beatrice Wishart outlined. The Scottish Government are committed to ensuring that people who have had a stroke receive the best possible care as quickly as possible to enable them to live longer, healthier and independent lives. To achieve this, we continue to implement our stroke improvement plan, which sets out priorities for improving diagnosis, treatment and care for stroke. We also continue to support the Scottish Stroke Improvement Programme. This enables us to ensure that NHS boards appropriately plan and deliver the high-quality, safe and effective stroke services that people in Scotland expect and deserve. Significant progress has been made. As James Donnan said, the mortality rate for stroke has decreased by 35.2% in the last 10 years, and the number of new cases of cerebrovascular disease, which includes stroke, has fallen by 12% over the same period. This shows our plan for tackling stroke is delivering real improvements, but we want and will continue to make progress on this area. So, David Stewart outlined the medical benefits of thrombectomy, and as Alexander Stewart and others noted yesterday, the first steps towards a national thrombectomy service for stroke patients was taken with the launch of a pilot in NHS Tayside for the north of Scotland, and Kenneth Gibson outlined how that would be rolled out for the rest of Scotland. It is really important that this life-saving procedure is available across Scotland. I'm also pleased to let the Parliament know that Professor Martin Dennis has been appointed as the Chief Medical Officer Speciality Advisor for Stroke Care, and that Dr Fiona Wright has been appointed as Deputy Speciality Advisor for Stroke. And both advisors are tasked with progressing the programme for government commitments, which members referred to earlier. Presiding Officer, work is currently ongoing to review the current stroke care bundle and to scope out what a progressive stroke unit will look like. We are working closely with our third sector partners, Chest, Heart and Stroke Scotland and the Stroke Association across all of our commitments on stroke. And we're particularly grateful for their work with us to ensure that people with lived experience on stroke are closely involved as we make progress against these commitments. Mr Stewart and Mr Donnan both and others actually mentioned COVID-19 and we are all too aware of the impact that COVID-19 pandemic has had on all of our lives. Some have faced the personal experience of ill health, some have lost a loved one, and everyone has had to deal with the impact of restrictions and adapting to a very different way of life. Brian Whittle and Kenneth Gibson both mentioned the Recoveries at Risk report, which details how the pandemic has affected every aspect of stroke treatment and care and has had a significant impact on people living with stroke. The recent publication of the Public Health Scotland report on the underlying causes of excess death in Scotland during the COVID-19 pandemic by area of deprivation clearly shows the impact that COVID has had on those living with underlying health conditions, an area that I recognise that Mr Whittle has a particular interest. It's important for us to fully understand this situation. That's why we're working with Public Health Scotland and the National Records of Scotland on a programme of research to understand the wider impact of COVID-19 on Scotland's population. Presiding Officer, Kenneth Gibson mentioned that the Recoveries at Risk report reports recommendations around access to mental health provision and support for carers. These are very important areas, and the pandemic has had an impact on people's mental health and well-being. This is likely heightened for people who are living with or caring for someone with a long-term health condition such as stroke. To respond to these challenges, the Scottish Government have worked with organisations from across Scotland to create a new online hub which provides a range of resources to help carers look after their physical and mental health. And I'd encourage anyone concerned to look at that and a range of other support that is available. Presiding Officer, I'd like to conclude by acknowledging again that despite progress over the last decade, stroke continues to have a significant impact on people in Scotland. Further to this, it is clear that the COVID-19 pandemic has created pressures on the healthcare service and affected service delivery in a variety of ways. This has undoubtedly had an impact on people living with stroke and on the services that provide diagnosis, treatment and care for these people. The Scottish Government continues to learn from our experience throughout the pandemic, and Kenneth Gibson outlined some of the innovations, and some of these innovations which have been brought about specifically for the pandemic, I think might be able to be continued after the pandemic to improve people's experience with maybe a little less virtual and a bit more blended, but the experience has been positive. So we continue to support healthcare services to build on the new and innovative ways to which they've responded to the challenge during this time of remobilisation of services, and which we hope will minimise delays in the future. Alongside this, through our programme for government commitments, we continue to drive improvement in the diagnosis, care, treatment and support for people with stroke, taking into account the legacy of COVID-19. By combining our efforts and working with partners, we can make a real difference to those living with stroke in Scotland. I look forward to continuing these constructive and productive discussions and to continue our improvements of stroke outcomes in Scotland. Thank you.
Thank you. That concludes the debate, and I close this meeting.